This is INCRadio, DZEM 954, the voice of truth, the official radio station of the Church of Christ or Iglesianicristo.
Good morning, good afternoon, and good evening. Welcome to New Jersey Satellite Studio, where we show you the flavor of life here in the District of New Jersey.
Hello, everyone. INCRadio New Jersey Satellite Studios, where we show you the flavor of life. And for today's flavor, we're talking about carpal tunnel. Oh, my fingers hurt already. What is it? What causes it? What is it preventative? Today, we're going to learn all about it through our physical therapist here on our show today, Sister Marisol. Welcome back. How are you?
Hi, good morning. Good morning, Naima. Good morning, Leia. And good morning to all our viewers who are watching today. I'm so excited about this topic. I'm hoping this topic will help a lot of our viewers.
Yes, Marisol, we've had you on before and we're so excited about this because a lot of people, I don't want to say it's age, but if you spend a lot of time clicking on a mouse, this might come to you. Even our athletes, I think. And those, I think anyone who uses their hands and their wrists a lot, who doesn't use their hands and wrists every day, are at risk for this, right? So we first of all want to thank Grace and Karen for requesting this topic to help all of us deal with carpal tunnel syndrome or pain in our wrists and our hands, which could turn into that. So we're gonna get started. Do we wanna put up the first graphic, Marisol, or do you wanna say?
Well, let's explain what carpal tunnel first is.
Okay. All right. And how common is it? So
yes. So for all the viewers out there, I'm going to refer in this discussion, I'm going to refer to carpal tunnel syndrome as CTS. It's easier to say and faster to say. So carpal tunnel syndrome is a medical condition where it involves the compression of the median nerve right here. If you look at your palm, the tunnel is between these two fat pads. So if you see this indentation here, if you can see at the illustration, this indentation here is where the tunnel is. So if the median nerve is compressed in this tunnel, that is what you call the carpal tunnel syndrome. So all of us, we all have the carpal tunnel. It's the carpal tunnel syndrome. That's the medical condition. Because some people say, "Oh, I have carpal tunnel." We all have carpal tunnel. Just to be clear. So if we look at the anatomy of the hand, so Kuya Tek, if you can show the second picture. So as you can see in the picture there, so these two fat pad, this is the thinner eminence and the hypothinner eminence. The indentation between these two fat pad is connected by a transverse ligament. There's a ligament that connects these two fat pad, and because of this connection, underneath the tunnel, the ligament, it forms a tunnel. Inside the tunnel, that's where the median nerve passes through. So the median nerve comes from our neck, from the cervical spine. It courses down our elbow, and then it exits here in the tunnel. So what's inside the tunnel is the median nerve and 9 flexor tendons of our wrist. So if you can see in the picture on one side shows you a normal carpal tunnel, and the other side shows you when the median nerve is compressed. Okay, if you can play the other picture, Kuya Tek, so we can show what's the importance of the median nerve? So the median nerve, it's both a sensory nerve and it's a motor nerve. Sensory nerve meaning it gives sensation to the hand, and motor, it provides the muscle action for our fingers. So if you pay attention to the picture, pay attention to the purple colored nerve, that's the median nerve. The white nerve is the ulnar nerve. So pay attention to what the median nerve innervates. So it innervates the sensation of the thumb, the point finger, the middle finger, and half of the ring finger, not the entire ring finger, just half of the ring finger. And the white nerve, the ulnar nerve, it supplies the ring finger and the little finger and the other half of the ring finger. Now, why am I emphasizing this? It's because you can rule out whether you have a real carpal tunnel or if you have an ulnar nerve problem. One of the questions in the carpal tunnel questionnaire is if it asks you, are you getting some numbness and tingling on the little finger? If you answer yes, then it is not a true carpal tunnel syndrome because the median nerve does not supply the little finger. So for those of our friends who have carpal tunnel syndrome, if you will pay attention to what part of your hand is affected. It should only be the thumb, the point finger, the middle finger, and half of the ring finger. So that's the sensory sensation. If you have CTS, you're going to have numbness and tingling on those fingers, and motor function also because the median nerve supplies the motor action of the thumb specifically, and also the finger flexors and the wrist flexors. So you're going to present with weakness of the hand. You'll notice that you're dropping things, you're clumsy because you don't have enough strength in your hand. Sounds exciting.
Wow, that's a lot. That's a lot. All right, but we want to dive deeper, so I'm going to toss it over to Naima for some other questions.
Okay, so here is a question. I don't know if can you hear me? Okay, good. All right, so the first question I have is, who is most at risk in developing CTS, and what's the main causes for CTS?
All right, so there's a lot of people who will be at risk, unfortunately, for CTS. But let's talk about what's the main cause of a CTS. Well, the main cause of CTS is the very main common cause is repetitive strain. So repetitive movement of your wrist. So that involves people who do a lot of typing, like Leah, right? People who do a lot of typing. So it's repetitive use of the finger and the wrist and the hand. People who are like assembly line workers who does a lot of sequential tasks where it involves their hand. Awkward positioning of the fingers. So say, for example, like when you're typing, right? If you don't have an ergonomic keyboard, if you tend to type like this, like our wrist should always be in neutral. Neutral meaning it's a straight line. It's neither flex like this or it's neither extended like that. It should always be neutral. So if you are typing and you don't have an ergonomic keyboard, you're typing like this, you're putting a lot of strain here where the carpal tunnel is. And on the other hand, if you're also overextended like this, like when let's say for weightlifters, like when they lift too heavy of a so you tend to hyperextend, and that's not good for your wrist as well. Other awkward position is what they call medically like the ulnar deviation of the wrist, where, for example, if you're holding a mouse and you're always like this, your wrist is always turning out. That's not good as well. And like the opposite of it, the radial deviation, where you go towards the thumb. So, for example, like workers who use a lot of screw driving like this, and prolonged gripping. So all those awkward position of the wrist, it puts a lot of strain in our carpal tunnel. Now, who are the people who are at risk? So knowing what causes the carpal tunnel, so just think of what you do, what your line of job, line of work is. So if that involves a lot of awkward positioning of the wrist, you are at high risk for CTS. And other conditions like obesity. So that extra weight that you have puts a lot of pressure on the carpal tunnel, and people who are obese also tends to retain fluid, and fluid can be retained in the carpal tunnel. It can pinch on the median nerve. People who have diabetes, high sugar levels affect nerves. A lot of our diabetic patients have neuropathy where there's damage to the nerves. So you are highly prone to getting carpal tunnel syndrome. Unfortunately, pregnant women also can experience temporarily carpal tunnel syndrome because of fluid retention and, the extra weight that you get from pregnancy. People with thyroid disorders, which can also cause fluid retention. People with rheumatoid arthritis, because the carpal tunnel at the floor of the tunnel, the carpal bones, for people with arthritis, the joints can be inflamed and it can pinch on the median nerve. And certain medications also, like corticosteroids, like it is anti-inflammatory, right? But prolonged use of corticosteroids can cause fluid retention and swelling.
Do you have any examples, Sister Marisol, what a corticosteroid is? Like, are there brands that you can mention? Not, we're not promoting, but just so we know if we're on a corticosteroid. Is that like prednisone or?
Yes. Mm-hmm.
Is it?
Yeah,
that's the only one that I know. The only corticosteroid that I know is prednisone. I don't know if there's any other.
Yeah, that is a corticosteroid. Yeah. Okay. So be mindful. Like I'm sure doctor will prescribe you that for a reason, but prolonged use of it, as with any medicine, there's always side effects. And hormone replacement therapy can also cause fluid retention. Too much estrogen. Yeah, so we have to be careful. And some oral contraceptions can cause fluid retention as well, and chemotherapy agents. Yes, I see reactions. And other risk factors are sports that involve like tennis, golf, pickleball, because you use a lot of wrist movements, and musical instrument players, like, right? So unfortunately, so many people are at risk for this.
Yeah, I used to play the guitar and I used to have pain in my wrist. And I used to be like, well, what is this coming from? And I think once I kind of laid off of it, it was fine. But yeah, that's interesting. Very interesting. Let me see, do I have it?
Yep. It's you again, Naima, but just to save us time. So we just want to know, Marisol, how is this diagnosed? Do we have to go through an MRI? Are we have to do weird tests?
No, carpal tunnel syndrome is easily diagnosed by either an orthopedic doctor or a neurologist, or even primary care physicians can also do that, because it's pretty straightforward. If the patient complains of numbness on those areas that I mentioned, so the doctor can do a physical exam or ask like a medical history questions. There's also like a CTS questionnaire, but there's an easy way. Like there are special tests that can prompt you to suspect a CTS, but I'm going to show you how it is done. But a disclaimer: you still have to go to your doctor, and don't worry too much. Like, oh no, I turned out positive for this test. I have carpal tunnel syndrome. But one of the tests is what they call the Phelan's test, Phelan sign. So if you do this and do this for like 1 to 2 minutes, and if you experience numbness and tingling in those areas that I mentioned, then you probably might have carpal tunnel. Or a similar test, the reverse Phelan's, it's still putting a compression on the tunnel. So if you hold this up for 1 to 2 minutes and you experience numbness and tingling, you might have carpal tunnel. You're both of you are good. I don't see any reaction like, oh, I have numbness or tingling.
I think I have lack of stretching. That's what I feel. I don't feel numbness.
Oh, good.
I feel
good.
stretching. That's what I feel. I was like, oh, okay.
And then there's another they call it the Tinel sign. So like if you tap this area right before the wrist, if you tap that and you experience numbness and tingling, then you might have carpal tunnel.
Wow, that's interesting.
I think all our viewers are doing that right now. So I
Oh,
hope you are good.
self-diagnosis, right? I was gonna
But
say, go ahead,
yeah, there's
Marisol.
other like very specific diagnostic tests, like if the physician cannot rule it out because there's like multiple nerves involved, which is possible. There's conditions where it's not just the median nerve that's involved, it can be other nerves in the hand too. So a definitive diagnosis for CTS is the nerve conduction velocity test, or the EMG, or the electromyography, where they, what you said earlier, Leia, about them sticking needles, and it's kind of painful.
Yeah, it's not fun. It's not fun, but also it's the only way they can truly, I guess, determine the severity as well.
Right,
Right,
yeah.
Marisol, the severity of your carpal tunnel. So unfortunately,
Yeah,
it's quite
if it
quite
requires
unpleasant.
surgery.
Yeah, it's quite unpleasant. Oh, I hope no one has carpal tunnel or CTS that's so severe that they need surgery, because that surgery is a long recovery, right? But anyway, before we get ahead of ourselves, so we talked about, you talked already about this. What are common signs that indicate CTS? I want to be a little more specific about this. How much pain do you have to be in, like on a level of 1 to 10, and for how long? Is this like everyday pain? Is it like a shooting pain? How do you know? Or maybe one day you were helping someone move and you injured your wrist. How long should you monitor that pain before it becomes concerning for CTS? So sorry,
Yeah,
a lot
so
of questions.
if the pain is really intense, if it's just a sprain, like you said, if you did something and you hurt your hand, and it should only last for 2 or 3 days, and it should get better over time. It's just purely a strain, right? But if it's persistent and the pain is too much, and you experience pins and needles, so the pins and needle sensation, that sharp stabbing sensation, is really what indicates a nerve pain, versus just muscular, or just other soft tissue structures. But if it's pins and needles, and if it's debilitating, meaning like you can't function anymore, then it's time to go get it checked.
Wow, that's kind of scary. Okay. So just to review, if you have numbness and pain in primarily this area, right? Because we saw in the graphic earlier. So this area, what if you have
Mm-hmm.
pain down here? If you have pain down here, that's not carpal tunnel anymore? Or maybe
Well,
the doctor had, you have to go to your doctor. Number one, we're not diagnosing anything on the show.
right,
We're just
but
sharing information. So please, if you have pain, you should definitely go to your physician for
it's still
proper.
possible.
Oh,
It's
really?
still possible, Leia, because the median nerve, as I mentioned earlier, it comes
Comes
from the
from the
cervical
neck.
spine.
Okay.
There's a condition called the double crush syndrome, where the nerve is affected in more than one area.
Oh,
So
no.
our median nerve comes from the cervical spine, and it can be pinched right here by the what we call the brachial plexus. So if it's pinched here, you can get symptoms even above the wrist.
Oh, I see. Okay. So it might not be carpal tunnel. It might be a pinched nerve here,
It's
which
a
sometimes
median
happens.
nerve injury.
Yeah.
Yeah.
I know you have all these scientific names, and I feel like it's like you're trying to make it relatable here. Um, so it looks like we might be having some technical issues with Marisol right now. Um, so, Sister Naima,
Mhm.
how long?
Hello.
Oh, there you are. Okay. I was going to say, hi, Marisol. Are you back? You're back. Okay. So, what are the treatment
I'm
options
back.
for CTS?
All right. So the main the depending on your symptoms, if you're having acute symptoms, meaning you're in a lot of pain, the main treatment is to just rest that part. The cause of the injury is because of repetitive use. So if you are in you're having acute symptoms, you're in a lot of pain, just rest that part. Doctors would usually recommend a splint, where I wish I have an example of a splint, but you know what I'm talking about. You wear a wrist splint, where it eliminates or reduces the movement of your wrist. That way, you're not causing more inflammation on your wrist. So the best way to treat carpal tunnel syndrome when you are having acute symptoms is to rest it. Some doctors will give you anti-inflammatory medications to decrease the inflammation, but the best thing to do is to just rest that part. Now, if you've recovered from the acute symptom, you should do some, if you are somebody who is at risk or you have recurrent carpal tunnel, symptoms, it's important that you strengthen your fingers, you strengthen your grip. Because come to think of it, if you have strong muscles here, if these two fat pads if they are strong because you're doing some strengthening exercises, if this is elevated, the ligament that connects it will also be elevated. So then you have more space in the tunnel, right? So it's important you want these muscles here to be really bulky. That way your transverse carpal ligament is elevated.
I'm staring at my hand. I'm like, how bulky are we? Like, should it be like super popped up? Like, we need to work out, I guess.
It should be higher than the indentation.
Okay. Okay, it is. Okay, I just want to confirm. Yeah, everyone's looking at their hands right now. I know.
So do a lot of hand, like the hand gripper. You can do that, and you can also strengthen individual muscles with the use of a rubber band. So,
okay, all right. Hopefully Marisol can come back. She's frozen on our screen, and she can demonstrate that. So Naima, how's your wrist? Is the two sides higher than the indentation on your hand?
I'm looking now. I don't know. It's funny, like when you don't really pay attention to it until you look at it and you're like,
yeah, I have a slight V.
Yeah.
Look at my head. Okay, Marisol, now that you're back, can you show us the rubber band thing again? You were frozen on our end. Oh, okay. We're now, this is how you know we're live.
Oh, okay. So
yeah, go ahead, Marisol. Go ahead. Oh,
can do this with your thumb to strengthen.
Oh, that's a little complicated.
Again,
so it's I don't have one. I don't have a rubber band. I wish I'd brought one. So it goes around the pinky, and around here, and then you just go like this. I think that's what she's showing.
oh, okay.
Is it around the middle finger as well? I think it's completely around the back. Naima, if you want to show it again. I usually have a hair tie here.
Yeah, this is why.
Go ahead.
I have a hair tie. I don't know.
Can you show the other side, Naima? The palm. Yeah. No, I think it's no. we really need Marisol to do a demo.
Yeah, I'm not the therapist here.
Exactly. You're a different kind of therapist, but yeah, our physical therapist is having technical issues.
Yes.
So I think Marisol, are you back?
Yes.
You are. Marisol, you're moving. All right, let's do it again.
Yes.
I am so sorry.
That's okay. You know what? We're gonna move on to our next question. We have you
Hello?
on. Okay, let's try it again.
All right. So you can it doesn't have to be all the way here. You can adjust it depending on your strength. But if you want a lot of tension, so you can connect it all the way to the little finger, so there's more tension. But if you have very weak strength, so you can adjust it according to what your strength level is.
Okay. I'm looking at the time, and unfortunately, we are almost coming to time, so we have to kind of wrap up our discussion. We have so many questions for you. Before we ask you for your shout outs, Marisol, we do want to ask you about quickly lifestyle changes and you showed us an exercise with a rubber band, but what about lifestyle changes and any kind of prevention?
Yeah, lifestyle change is really, really important. So if you are your job entails a lot of wrist movement. So you have to strengthen your wrists. You really want to prevent this from happening. You don't only do this because you have CTS, but do it if you're at risk so you don't get it. Prevention is always better than cure. So lifestyle changes, make sure you switch to ergonomic. If you are type a lot ergonomic keyboard, the principle is you want to pay attention that your wrist is always in the neutral position. That's the best way. So whatever change you're going to make to your keyboard depends on, like your workstation. That's the principle behind. Keep your wrist neutral. proper posture, always proper posture. All our joints should be in the neutral position. Like even up here in the by the neck, you don't want to be rounded. Your head should. We discussed this before with the postural education. Show that we had always make sure that all your joints are in the neutral position. Take a lot of breaks. If you can't help it, if your job is typing and you really can't help it, you can't quit your job, right? But hopefully you can talk to your boss to allow you to take frequent rest periods, frequent breaks, and do stretching in between so that you don't cause that inflammation and swelling in the tunnel.
Wow. This is a lot. Like I even just checking my posture. It's like, how do you? Okay, you have to rewatch that episode where we talked about posture. That's the best thing. Or ask your doctor to check your posture. All right, Marisol. So I think what is one thing that the audience should remember? Like, what's the biggest takeaway from this discussion?
Yeah. So prevent these injuries from happening. Do constant regular stretching exercises. You don't do the wrist flexor stretch or the wrist extensor stretch when you are having acute symptoms. These are to be done when you are in the recovery phase or even as a preventative measure. So always and keep a healthy lifestyle, because we discussed how obesity and other medical conditions can contribute to carpal tunnel syndrome. So always stay healthy. The bottom line really is to stay healthy, because being unhealthy can give you a lot of problems, not just CTS.
Yes, no, agree. All right. So what about your shout outs? We're so happy that you're here with us to educate us. So do you have any shout outs?
Yes, I just want to say hi to my parents in Zamboanga City and to my family. I hope you get to watch the replay. I know it's already late there. And to my in-laws in East Orange, I hope you get to watch the replay too. And special shout out to a newfound friend, Roselia Leviste. I hope you can watch this replay as well. And to my friends and to my family, Brother Brian, Brother Gabriel, and Brother Caleb. Happy weekend.
All right. Thanks for that, Marisol. We're going to move on to our shout out section. We're not going to do the bumper because we're short on time. So, Naima, do you have any shout outs?
Yeah. So since we've been talking about carpal tunnel, I used to play an instrument and it felt like I had some interest, challenges there. So it had me thinking about my vocal coach as well as my musician teacher. His birthday is coming up. It's actually this week coming up. So happy birthday, Owen Brown. Woo-hoo. Please check this video. It is out.
All right. Thanks for that, Naima. We want to say hello to our live viewers. Mario Oka from Brixtonville, District of Caloocan North. Tamara Stevens says, when I'm braiding my customer hair, I stretch my hands. Joseph Palabrica says, as someone who plays guitar and video games with mouse and keyboard, I'm definitely listening to this. We do have a number of questions, Marisol, in the live chat, just to give you a heads up. Would pins and needles like acupuncture help CTS? That's from Jeff, from Brother Bernard Gerzon. Is it true that after typing for a long time or playing the piano and then washing your hands with warm water may cause CTS or no relation? And then from Tamara, she says, can you use a squishy ball to help with hand exercise? So if we have time later, we will come back to those questions. We also have birthday shout outs. Happy birthday to Mikhail Kabiling from Bergen. That's from Jeff. Belated happy birthday to Ka Arnolfo of Philadelphia. That's from Michelle Rizal. And also belated happy anniversary to Brother Derek and Sister Sai Garoda of Philadelphia. And belated happy birthday to Shadi Valenzuela Fernandez from Brother Jeff. All right. So we're going to move on to our next segment. I'm tossing it over to you, Naima. Activity updates. So if we could have the bumper to our tech.
Activity updates.
All right. So for our activity, please save the date for May 18th. We have the special gathering for the Chroniclers, and that is May 18th. Once again, we also have May 26th. It is the flag football activity. So please don't forget to register for our flag activity on flag football activity on May 26th. May 26th.
Yep, that's Monday, May 26th. All right, it looks like we have a live reporter joining us. Hello, Mazen. You are muted, so if you're ready. Hi, Mazen, how are you?
Hi, Ate. How's our audio po?
Audio is great. Can you tell us what's happening and where you're from, actually?
Yes, Oh, hello everyone po. So
I
right
think
now we are have ongoing activity.
Mason, we're
Oh, it looks like that we are a bit paused there, Sister Kathleen. Are you back?
I
Okay.
think hi. I think it's me. I think it's me. Go ahead, Mason. What? Tell us where you're from and what is happening right now.
Yes po. So right now we're in the district of Greater Toronto. We have this ongoing activity called Care for Humanity po. Together with Assets Brother Regine, we po po sila ng RGT to give us more update or information about our ongoing activity po. Here's Brother Regine po.
Hello, Brother Regine. Could you tell us what is happening in today's activity?
Good afternoon, po, brother and sister. What happened right now in the Greater Toronto District of Greater Toronto? We are doing the Care for Humanity for the celebration of the 139th birthday of Brother Felix Manalo, our God messenger in this last day. As of now, they're showing the video with regards to Care for Humanity here in local congregation of Midtown Toronto, which is the district of Greater Toronto located.
There's more information for us. There will be going through the appropriation, and then after that there will be outside.
Yeah, what will happen today? We will have a giving of care packages to the all visitors who attended for Care for Humanity, and also we will have a clothing donation that is located at the back of our function hall and at the outside of the district of Greater Toronto parking area. We have the CMDPS. We have a blood donation check up, and also hair cutting, and also the food that we will share after this gathering po.
Okay, so thank you so much for sharing, brothers and sister. We appreciate you. Do you have any shout outs?
Shout out po to our beloved district minister, Brother Raul F. Adalia, Brother Isidro Tina, our assistant district minister, and also Brother Cartino, our CFO overseer, especially to our beloved executive minister, Brother Eduardo B. Manalo, and Brother Angelo Eranio Manalo for continuing helping all the activities inside the Holy Church. Thank you so much po.
Thank you po.
Thank you,
Thank you so much for your report. Thank you. It sounds like a fun activity with even free haircuts.
Love that. Love that. All right. So it looks like we are headed to close the show. Sister Kathleen, are you there?
Hi, Naima. Can you hear me? I'm having some technical issues, but it is time to close out the show.
Yes, we can hear you, sister.
Okay, so that is it for today's show. Sorry about the video. Thank you for everyone who tuned in today. If you found value in our discussion, please like and subscribe for more content like this. And if you think this episode would be helpful to someone you know, please share the link with them. And if there's a topic you'd like to hear, or want to join the panel for a discussion, please feel free to reach out to us. And before we go, we'd like to thank our church administration for their continuous support in INCRadio and allowing us to have this show where we can stay connected and learn together. We also thank our live reporter for joining us today. But we also thank our beloved executive minister, Brother Eduardo Manalo, and our SEPC president and CFO coordinator, Brother Angelo Manalo. We'd also like to thank our INT radio station manager, Brother Wally Tarai.
And before we say goodbye, we again thank all of our viewers for taking the time to watch this episode. See you next time.
Bye, everyone.
Bye.
Keep your wrist neutral.